Hello students, and welcome to tutoring, and thank you for coming. My understanding is that you are having difficulty understanding heart failure, okay? Heart failure is a hard topic, and it can be difficult to understand, and it can be a challenge, all right? But today I'm going to teach and tutor you by using a flow chart that I think will help you understand how heart failure works, all right? First of all, anybody know what heart failure is? John? That's correct, John. Just like John said, heart failure is failure for the heart to function properly, okay? The heart is unable to pump blood to the body for the oxygen that is needed, okay? And we'll talk a little bit about that, all right? Very good. All right, some of the causes of heart failure. Are we familiar? Correct, Sarah. I have that right here. High blood pressure, ischemic heart disease, myocarditis, valve disorders, which means when your valve in your heart is not functioning like it should, arrhythmias, and metabolic disorders, okay? And we'll talk a little bit about that, all right? Let's talk about the risk, modifiable. What do I mean when I say modifiable? Mike? Very good, Mike. Something that we can change. That's correct, that's correct. Modifiable risk, smoking, high blood pressure, diabetes, physical inactivity, being overweight, and high cholesterol. When I say we can change, doesn't mean we can stop, but we can control, okay? If that makes sense, we can control, all right? Non-modifiable is something that we cannot change, all right? Age. If you're over 50, you're at a high risk for heart failure. Ethnic background, okay? African Americans are a high risk for heart failure. And family history. If your mother or father had heart disease, congestive heart failure, heart attack, okay, then you're at risk, okay? Let me give you an example. If you're over the age of 50 and African American, and you have a family history of heart failure, you're a high risk for heart failure. Does that make sense? All right, good. All right, here I've created a heart, okay, using Play-Doh, okay? You can see the aorta, the pulmonary artery, and vein, okay? If you see the white here, this is plaque. Plaque is what causes your heart not to functioning properly, okay? The plaque gets in there and it causes a blockage, okay? Then the heart can't pump the blood as we talked about earlier, all right? Let's talk about some treatments. Self-care, okay? What do I mean by self-care? Sarah? Very good. Things that we can do for ourselves. That's excellent. Exercise. Stop smoking. Diet and lose weight, okay? Exercise and diet can control high blood pressure, diabetes, and high cholesterol. Very good, all right? Medications, diuretics. Who knows what diuretics are for? Mike? Very good, to remove fluid. But we have to be careful when fluids are removed because we're removing what also? Potassium, right? So if our potassium is too high or too low, then we can have arrhythmias, metabolic disorders. Very good, all right? Diuretics, we talked about, ACE inhibitors, antihypertensive, cholesterol. And sometimes doctors start patients on aspirin. What is aspirin? Tommy? Very good. A blood thinner, which helps to thin the blood to prevent the plaque in the heart. Does that make sense? Okay? Any questions? All right. Once again, thank you guys for coming, and I'll see you next week with tutoring.